Hi everyone, my name is Monique Perez and today I'm going to tell you a little bit about the University Medical Center of Southern Nevada, or better known as UMC. The University Medical Center of Southern Nevada, or commonly known as UMC, is a nonprofit hospital funded by the government, dedicated to serving our community by providing patient-centered care in a fiscally responsible environment. This hospital was founded in 1931 and has been a great teaching hospital that is affiliated with the UNLV School of Medicine. UMC is one of the largest public hospitals in the U.S. with a capacity of 497 beds, including 357 service beds and 140 special care beds. UMC stands out in Nevada because this is where our state's only Level 1 trauma center and pediatric Level 2 trauma center, as well as Nevada's only burn center. This burn center that was established in 1968 is the dedicated care for burn patients in Nevada, Utah, Arizona, and California. They perform the highest level of trauma care, making them a core component in our emergency medical system. UMC also delivers many different medical services to their patients, including areas of bariatric medicine, a center for transplantation, emergency services, Healthy Living Institute, Heart Center, Wellness Center, radiology, infection prevention, burn care center, lung cancer screening, oncology care center, outpatient physical therapy, robotics, surgical services, a trauma center, and a woman and newborn care center. One of the services that I find especially interesting is that UMC is one of the only hospitals in Nevada to have a Da Vinci Xi machine, which is a huge breakthrough in surgical technology. This machine can be used in a variety of different surgeries in urology, gynecology, and general surgery. If you haven't heard of this machine, it is especially efficient as it performs surgeries in the least invasive and most precise way. As you can see, UMC covers a very wide range of services. UMC might not have the same type of employees as you would find in other hospitals, and this is because of the educational partnerships they have. UMC is partnered with the UNLV School of Medicine, Touro Medical School, College of Southern Nevada, and Roseman University. They also have a Department of Pharmaceutical Specialties residency program that is accredited by the American Society of Health System Pharmacists. UMC is a teaching hospital, which means you will see students, interns, and residents fresh out of school all over the place. A large group of their staff is students that were previously interning there or have just graduated from one of the partnership schools. This gives them a fresh group of motivated individuals that have a recent education. Right now, they probably have a little less than 4,000 employees, and this number includes all of the doctors, nurses, administration, and all other staff. As an academic medical center, UMC has a diverse group of individuals working for their company. As a student at UNLV, I've met many people that work and volunteer at UMC, so I've gotten a feel for their company culture. Their vision statement is to be the premier academic health center, which shows how dedicated to teaching and improving healthcare they are. UMC has a mission to serve their community in the best way, but also have an underlying mission that focuses on research and education. I think that this type of environment definitely encourages teamwork. I think that the culture at UMC is one of excellence because of the people that it attracts. The people there are deeply committed to their field and eager to learn more. Having peers with the same mindset gives more chance for innovation and bigger opportunities. I think that students, professors, and people alike are all motivated and more willing to work as a team towards a common goal, which might not be the same at other organizations. In support of this culture of excellence, UMC has a code of conduct that is in place to promote conduct that is honest, ethical, and legal. To provide the best patient care, it requires the efforts and commitment of all staff at UMC. UMC also has an equal opportunity and affirmative action plan that promotes their mission of creating a workplace that reflects our community. They hire a diverse staff that can recognize and respect the value of everyone's unique personal characteristics and experiences. Having a diverse staff allows different types of people to create new relationships with each other and learn about each other's cultures. They support their diverse workforce in its goal of exemplifying compassion, accountability, integrity, and respect. At UMC, there's a leadership team running the hospital, but also a board of trustees and a governing board. The leadership team is led by the CEO, Mason Van Houweling, empowering the administrators to do all they can to provide the best care possible. Under the CEO, there are 11 others providing leadership for the hospital, including a Chief Experience Officer, Chief Nursing Officer, Chief Human Resources Officer, Chief Operations Officer, Chief Information Officer, Chief Administrative Officer, Chief Financial Officer, General Counsel, 2 Associate Administrators, and a Chief of Staff. There's also a board of trustees that includes 7 commissioners whose main focus is on the nonprofit aspect and ensuring that the organization achieves its goals. They meet twice a month and their meetings are open to the public. And the last, but still very important part of their leadership is the governing board members. This board is 9 individuals that have been selected by the Clark County Commission that are responsible for developing and reviewing the hospital's overall mission and strategy, as well as making sure that it remains a vital resource in the community. Overall, UMC of Southern Nevada has a great leadership team looking over them, in addition to wonderfully educated staff that are all there to provide the best service and care to our community. UMC sees a variety of patients from all over the Las Vegas area. Their patients pay in a few different ways. According to the reports from UMC from 2017, 47% of the patients seen at UMC pay with Medicaid, 23% with Medicare, 20% with commercial insurance, and 10% with other. This may seem like a bad thing financially if your hospital is mainly serving the poor or underserved population, but that's not true. Hospital-level fixed effects regression analysis finds that hospitals with higher Medicare and Medicaid payer mix collect somewhat higher average patient care revenues than hospitals with more privately insured and self-pay patients. If you think about it, when you have a patient with government-sponsored insurance, you can almost guarantee you're going to receive the money for the service that you provided. If a patient comes in claiming that they will pay themselves or have other means of insurance, sometimes it's not guaranteed that the service will get paid for. For UMC and other hospitals alike, it's important to understand your payer mix so that you can improve payer relations, market toward select payers, and optimize your collection efforts to essentially increase cash flow. I was able to access the Nevada quarterly reports for the hospitals here in the area. From this report, I was able to see a breakdown of UMC's revenues and expenses. First, their total operating revenue for the first 3 quarters of 2019 is $168,960,443. This operating revenue includes inpatient, outpatient, long-term care, clinic, subacute, and miscellaneous patient operating revenue. UMC's total operating expenses for this year total up to $176,206,019. Unfortunately, this left UMC with a negative operating income of $7,245,576. Regarding their non-operating revenue, that was counted at $2,425,260. And non-operating expenses were at $282,864. Even with these numbers added, UMC still had a net income loss of $5,103,180. UMC is a not-for-profit hospital, though, and the net income loss could be due to many reasons, such as charity care and non-payment from patients. I refer to charity care because, according to the reports, UMC provided a total of $68,705,567 worth of patient charity care, which is relatively high compared to the other acute care hospitals here in Nevada. As an academic medical center with a rich history of providing life-saving treatment in Southern Nevada, UMC serves as the anchor hospital of the Las Vegas Medical District, offering Nevada's highest level of care to promote successful medical outcomes for patients. And that is the UMC difference. Thank you for listening.